Hello and welcome to the podcast by Bayer for Health. Today we are diving into the health topic that is more common than you may think: deep vein thrombosis or DVT. When you pair DVT with its dangerous cousin, that is pulmonary embolism, it becomes the condition called VTE, which is venous thromboembolism. Believe it or not, a global study across 30 countries, including right here in India, found that over half of the patients admitted to the hospital for critical care are at high risk. Or, in fact, for every 10,000 patients who are admitted in the hospital in our country, about 17 of them will face complications like DVT or VTE. So, today it is one of the biggest hidden risks in the hospital care today. To provide expert insights on this crucial topic, we have Dr. Kanika Sood Sharma with us. Dr. Kanika Sood Sharma, she is a radiation oncologist in Dharamshila Cancer Hospital, very renowned hospital in Delhi, NCR. Welcome, doctor, on behalf of Bayer. So I just wanted to understand what is DVT, how you define DVT.
So DVT is an abbreviation we use for the term deep vein thrombosis. So if I can just, decipher all these three letters separately, deep means something which is not at the surface. जो muscles होते हैं, body के muscles, almost muscle planes के बीच में the vasculature which is running, these are the deep veins. And in these veins, when there is a clot, that is called thrombus. So medically, the clot is called thrombus. So a medical condition where there are thrombus is being formed in a deep vein is called a deep vein thrombosis. So it is not a natural phenomena. It is a problematic situation. That is why today, the discussion which we will be undertaking is of importance.
Thank you very much, doctor. I want to understand who are the patients, like which category of patients they are at high risk of getting DVT, and what are the common causes?
So DVT can happen to anyone, firstly, but there are certain cases which would be at higher risk. Especially, I would say DVT loves three scenarios. DVT loves slow flowing blood, DVT loves damaged vessels, and DVT loves medical conditions where your coagulation is activated. So people who are having these either as a singular or as a combination will be more prone. So how can blood flow slowly? When there is some obstruction. If there is a tumor sitting and it is not allowing the blood to flow through the vein, it is at stasis, or patient is not moving. When we walk, our muscles are permanently compressing these veins. As I told you, these deep veins are in the muscle fat planes. So when we walk, these muscles are compressing, and just like pump, जैसे heart pump करता है, the blood from the center to the periphery, your calf muscles are working like heart muscles to push blood from veins towards the heart. So if something is not pushing it, you are not moving your leg, you are lying down for long duration, 6 hours, or you are in a flight where you are unable to move for the known reasons. So there, when the blood flow is slow, then the risk increases. Secondly, when the vessels are damaged, damage can happen because of trauma, it can happen because of certain drugs or procedures. Like sometimes, you see that a lot of patients, we require multiple cannulations, IV fluid cannulations, or sometimes some PICC lines need to be introduced for chemotherapy patients. So here, because of the vascular trauma, when the vessels are damaged, then the chances of thrombus formation again increases. And third scenario is when your blood coagulation profile is different. In our body, there are multiple coagulation cascades. Body has regulatory systems which dictate ki blood clot hoga ki nahi hoga. So if that is deranged and your tendency to have clots increases, so that increases your chances of these clots. So all these three scenarios can happen in patients who are obese, patients who are undertaking long travels, patients who are bedridden for either palliative care, terminal care patients, or because of some surgical procedures. You see, there are patients who undergo hip replacement. So hip replacement, fat embolism, and DVT, these are very common scenarios. So anybody who is confined to the bed and has no movement is at risk. Major abdominal surgery patients are at risk. Cancer patients in particular are at risk because cancer, has very different mechanism of increasing the coagulability. So these are majorly the risk scenarios. And nowadays, medical fraternity is very conscious. So now what happens is whenever we admit a patient, when we do the initial workup, initial day, there is a form which is filled. Is this patient susceptible to vascular embolism? VTE prophylaxis is required or not required? So these are the risk categories which we are more cautious about.
Thank you. So if I understand you clearly, like immobility because of any reason, maybe because of the surgeries or any reason, or a long distance travel, where which makes you sit for a longer duration, can be a main cause of DVT. If I understand you clearly.
Yeah, and I'll add another point, smokers. And if on
Okay.
top of this, if you have been a smoker, smokers' vessels are damaged. So that again, increases your risk towards development of DVTs.
So you also mentioned that cancer could be one of the cause of DVT, and being a radiation oncologist. So I wanted to learn from you if you can elaborate on this, how cancer could be a cause of DVT.
So cancer can have multiple parallel reasons for having increased risk of DVT. We identify certain tumors just by the DVT. There are some tumors who may not throw symptoms. These include pancreas cancer, stomach cancer, and the upfront pehla symptom ही DVT होता है, and we call it Trushew's phenomena. And when somebody finds sudden DVT, then you look for, there might be some hidden tumor inside the body which has caused that. So there is a tendency of certain cancers that they cause more DVT, like myelomas, lymphomas, lung cancer, brain tumor patients. So, because of hypercoagulable state, some chemicals are released from the cancer cells which make your blood more prone to clot than any normal person. Secondly, in the tumors, the vasculature is very abnormal. जैसे plain vein नहीं होगा, गुच्छा बन जाएगा. Like those cluttered vasculatures, the blood flow becomes stagnant. So because of these damaged vessels, the blood flow is stagnant, and ऊपर से अगर कोई tumor compress कर रहा है, there's a tumor which is not allowing blood to move at all. These make the cancer patients much more prone. Then additionally, if you see, most cancer patients who are going to receive chemotherapy, we put some devices in their body. We might put PICC lines, we might put a chemo port. So any device which is lying down in a vessel is again making you prone to DVT. Sometimes, we see 1 or 2 cases in a year where the device has to be removed because patient has developed DVT. So that is the proneness, which can happen. And as I mentioned, certain cancers in itself have that tendency of altering the coagulability and making the blood more coagulable. And certain drugs also have a tendency. Many drugs also can, increase your risk of having DVT. So it is multifold reason by virtue of which cancer patients have this. And as I mentioned previously, if patient is terminal cancer patient, movement is totally restricted, patient is bed bound, there is no movement, and that immobility definitely would increase the risk of DVT.
Thank you. So I just wanted to learn what are the signs and symptoms of DVT, how the patient will come to know, because he is going to the hospital for certain disease or treatment, and then you, as you have explained, he may get developed DVT. So how he'll come to know he should visit a doctor for DVT perspective?
So I think firstly, I would, really appreciate your efforts, first of all, that you are arranging a talk on this topic, because 99% of our patients don't know that there is something called DVT and they have to be cautious about this. Right? So the awareness is lacking. For that reason, 50% times you don't even know DVT has happened. Patient will have subtle symptoms, but they would not know. And mostly patient will give you a call, पैरों में सूजस आ गई है. So that swelling, which is a very early sign, sometimes may be confused with low proteins, anemia, or kidney problems. So these are signs which, if they are not picked up in time, it can become catastrophic in form of embolism. So first and the foremost symptom which patient should know, that sudden swelling in the leg, or if there is a chemo port or PICC line in the arm, and asymmetric, like it is not happening in just one leg. It will only happen on the affected side. So a single leg edema can be the most common presenting symptom. If that is ignored, then patient may experience calf pain. The moment the patient moves the leg, there will be pain in the calf region, which is excruciating. Subsequently, there may be redness, and the pain may be excruciating. Fever also, thrombophlebitis when sets in can cause fever. And if this is ignored, sometimes the blood circulation, if it is not going, chronic vascular changes or insufficiency can lead to skin blackening and even necrosis. So earliest is edema, and particularly if it is asymmetric, it is happening only in one of your limbs, that is something you should be watchful about.
Okay. So if like suppose patients comes to know about the pain in the calf, redness and the swelling, so what he should do or he or she should do the
So I'll tell you, mostly people, what people do, there is some swelling, they will start massaging or they will start putting
yes,
some cold
absolutely.
thing or heat pad. So this is something which you should avoid. Because if you start massaging that leg, that clot will break and dislodge and it will go and impact, get lodged in the heart or the lungs, which can be fatal.
Yeah,
If
better.
you find any such swelling, do not move that particular limb, do not rub it, do not massage it, do not apply heat to it. Immediately talk to your doctor and don't start self-medicating. And once the doctor establishes that it is a DVT, an immediate medicine needs to be started. See, this DVT is so critical. I'll share that when I send my patients for any investigation, radiology, if there is a DVT, there will be a critical alert which will be raised to the treating doctor so that the case does not get missed, because we have to start treatment so fast. The more delay happens, the more the chances that the blood clots will travel to the other parts of the bodies, particularly heart, as I mentioned. So do not sit over it. Don't wait that let me see for 1 2 days, swelling hi hai, theek ho jayegi. That is something which can be catastrophic.
So as you mentioned, you send your patient for the diagnosis. So I just want to know how doctor will come to know about that the patient is suffering from the DVT. What are the tests available for diagnosing?
Right. So it is not that any patient who comes to me with swelling in the leg, I will directly send for, test. So there are beautiful scoring systems. Those scoring systems, you have to see whether all these factors are existing in your patient. He is a cancer patient or has had paralysis for 6 months or has had some pelvic surgery, has been immobile, has been on certain drugs. So after that scoring, we stratify our patients into low risk, moderate, and high risk. For moderate risk patients, we will directly order an ultrasound and a D-dimer. D-dimer is a protein fragment. When the clot starts to break, this comes into the circulation so we can measure its value. So in moderate, we do both. In the category which is high risk, we don't even need D-dimer. We directly go for ultrasounds. Sometimes the clot may not be in the leg. Like few patients, the clot may be higher up in the pelvis. Then the ultrasound in the leg will not help. In that scenario, sometimes we do CT angios to locate the higher up clots as well. And in case patient is having breathlessness, then we might do an echo and CT pulmonary angiography to check that whether this clot has not already broken and gone to the heart or the lungs.
So what are the treatment options available for DVT?
So see, we should firstly know what is the aim. So aim first is that we have to stop this process by which the clot is forming. So the clot formation has to be stopped, and that is done by anticoagulants. So anticoagulants, there are a lot of different ways of doing anticoagulation. When we were students, we had only warfarin. All patients were given warfarin. But it was risky in the sense that we have to monitor INR very frequently. Patient would have bleeding tendency also. So one of the oldest, very good drugs, but very, very difficult to monitor. Then came the era of, the heparins, then the low molecular weight heparins, but these are injectable. So initially, if patient is admitted with me and there is a huge swelling and I need urgently to start, then we start on low molecular weight heparins. Subsequently, for domiciliary or if patient is not having urgency, then we may have oral anticoagulants. Nowadays, we have a lot of oral anticoagulants also, which fortunately have a big advantage. Firstly, that they need not have repeated pricks. And monitoring is not very vigilant. You may not do INR because the bleeding tendency is not increased by these drugs. So these are the options available in context of the anticoagulants to stop the process. And slowly, slowly, when the coagulation profile is corrected, the clot's body reabsorbs and channelization or the recanalization may happen over 3 to 6 months. Sometimes, very rarely, you may need to surgically remove the thrombus. We call it thrombectomy. Although this is a very rare scenario where the vascular surgeons may have to, go and remove the clot because it is obstructing major blood vessel and it is not recovering from your anticoagulants. Very few patients, I would say once or twice in a year, sometimes I have to get IVC filters also placed for my patients. These are patients where, supposing brain tumor, and there is bleeding in that brain tumor, platelets are low, and I cannot give an anticoagulant. In those scenarios, we put filters. The filter will just prevent the clot from going to the heart. So that filter is strategically placed at a place so that if any clot is breaking and the clot products are coming up, the filter will stop them from going to the heart. So these are the therapeutic interventions. And then once the injections have been started, limb elevation, compression garments, and other ancillary anti-edema measures, painkillers, these are the things which are supportive, which are added to the treatment.
Okay. So how long you will suggest the treatment for the DVT, suppose if the patient is going for the oral therapy?
So, see, by and large, for low, moderate risk patients, 3 months minimum are required. Most of our patients. By average, I see most patients who are moderate risk to high risk, 3 to 6 months of therapy is indicated. But patients who've had recurrent DVTs and there are likelihood that he will develop or she will develop DVT, sometimes we continue the anticoagulant lifelong, especially end of care patients. I will just mention here there are certain palliative care scenarios where sometimes we are giving some injections to boost their hemoglobin. We give erythropoietin. So erythropoietin also increases this thrombosis chances. So there we might want to give a longer duration of a antithrombotic agent to ensure that patient does not develop DVT.
So what you will recommend do's and don'ts for the patients for DVT?
So firstly, I think the biggest medicine is motion. बैठे मत रहो, right? If you are, a caregiver of a cancer patient, do encourage your patients for passive exercises at least. Some limb movements, even if they are passive, will ensure that blood is not stagnant. So if they are doing some, passive exercises, the first risk factor of immobility is being taken care of. Second, if they can do walks, at least 30 minutes of walk in a day will move the calf muscles. As I mentioned, calf muscles are like heart to the deep veins. They will ensure that the blood is being pumped towards the heart. Thirdly, is that be aware of it. Discuss with your doctor when you're starting treatment that I have heard that cancer patients can get DVT. Am I eligible? Because see, sometimes I may not say that for all doctors, sometimes you're so busy in the OPD that you're, so worried about the cancer and treatment. Sometimes DVT screening may be missed. So if a patient himself prompts, doctor will definitely say, yes, yes, let me see. And in case you are eligible, then he might discuss with you the DVT prophylaxis procedure as well. And be aware and alert of the symptoms which we told you, edema, that is the swelling of the leg, redness, pain coming in the calf. Do not sit over this triad. This triad of symptoms should not be ignored. You should be reaching out to the hospital earliest in case of these symptoms. And if they develop, don't start massaging, don't start applying heat because that will be detrimental. And follow the protocol. If your doctor has prescribed you medicine, do not miss your anticoagulant. Do not take it double also. And if you find that your body, you are seeing some blue marks, you are seeing some nasal bleed, then immediately report to your doctor. You might be having some extra, bleeding tendency, which might require revision of your medications.
So in the early of our discussion, you said that smoking is also a cause of this developing DVT. So in the this modern scenario with a sedentary lifestyle, busy lifestyle, hectic lifestyle, what measures you will suggest to prevent the developing of DVT?
So see now, our honorable Prime Minister also says work from home. But so being on the desk, it is a very bad lifestyle. It is not lifestyle, it is not a choice. It is eventually something which is happening post COVID that most people are getting to be, glued to the computer screen. So in that, we always say two, three things. One is for your physical health and one is for your eye health. For eyes, we always tell people that after every 20 minutes, for 20 seconds, look 20 feet away. For your legs, after every 60 to 90 minutes, get up, take a stroll in the house, or if you're in the office, just take a stroll, walk around, and then come back. Break that consistent sitting thing. If you are in the flight and you are expecting 6, 8 hours of journey, so from the aisle, just take a walk 2, 3 times during that course. And while sitting also, you can do movement of your feet, ankle rotations. You can rotate your feet like this and dorsiflexion. So that also ensures that your leg movement is happening. We as doctors, we stand in operation theaters for such long time, and our
Yes.
teachers always kept on telling us, एक पैर से दूसरे पैर पे shift होते जाओ. So even in a static position, there are means to rest or to bring movement to your legs. So that is again something, especially not the cancer patients, but general public, which can do during long travels and during long desk jobs.
So thank you, Dr. Kanika Sood. This has been really an insightful discussion. So before we wrap up, what key messages would you like to give our listeners regarding the DVT prevention?
So I think the first and the foremost, as I already mentioned, that prevention is the key, and prevention is by mobility. If you walk, if you're mobile, your chances that you will get DVT is less. Be aware of this medical condition, because it is the ignorance of the medical condition which leads to catastrophic end results. Because if we ignore the heart, the clot may go into the heart and cause breathlessness and sudden death. So be aware of this medical condition. If symptoms appear, do not sit over those symptoms. Immediately, promptly reach out to your doctor or the healthcare facility so that they can or confirm that it is DVT or not. And once it is confirmed, of course, then the medical line of treatment will be there. So ignorance and delay are two things which should not be in your life in general for any health disease, including DVTs.
Thank you. Thank you very much, Dr. Kanika Sood Sharma.
Most welcome.
Thanks.